the first spill. My name is Maya A. Harris. I'm an executive resident here at APHA, and I am delighted to be your host again. This month, we are featuring 5 newly approved drugs or digital therapeutics. And in this episode, I'm going to be talking about aprocitentan, which is a tablet that was FDA approved for the treatment of hypertension in combination with other antihypertensive drugs to lower blood pressure in adult patients who are not adequately controlled on other drugs. Now, aprocitentan is an endothelin receptor antagonist approved in March of 2024 for the treatment of hypertension with a recommended dosage of 12.5 milligrams by mouth daily with or without food. Now, what's really unique about this drug is that it's the first endothelin receptor antagonist to be approved to treat systemic hypertension in 40 years. Other drugs with the same mechanism of action are drugs like ambrisentan, bosentan, and macitentan, and they're actually indicated for pulmonary arterial hypertension. Now, the approval of aprocitentan was based on data from the phase 3 precision study, which was conducted in adults with uncontrolled blood pressure identified as a systolic blood pressure of greater than or equal to 140 millimeters mercury, despite the use of at least 3 antihypertensive medications. And in this study, patients were started on a fixed dose combination regimen of amlodipine, valsartan, and hydrochlorothiazide for 4 weeks. Now, those that remained hypertensive after that period were randomized into 3 different groups, which compared aprocitentan 12.5 milligrams versus aprocitentan 25 milligrams versus placebo for 4 weeks. Now, patients were then given aprocitentan 25 milligrams for 32 weeks and then randomized to either aprocitentan 25 milligrams versus placebo for 12 weeks, totaling 48 weeks. So the primary outcome was change in mean systolic blood pressure from baseline to week 4. And in the aprocitentan 12.5 milligram group, there was a statistically significant decrease in systolic blood pressure of 3.8 millimeters mercury and a statistically significant decrease in systolic blood pressure of 3.7 millimeters mercury in the aprocitentan 25 milligram group. Now, interestingly, at week 40, systolic blood pressure remains stable with aprocitentan 25 milligrams, but significantly increased with the placebo. Now, when it comes to adverse reactions reported in this trial, it was found that fluid retention was reported in 9.1% of the participants on aprocitentan 12.5 milligrams and 18.4% of the participants on aprocitentan 25 milligrams compared to the 2.1% of participants with placebo. Now, from these findings, we can interpret that aprocitentan resulted in short-term sustained blood pressure lowering and that the use of aprocitentan may increase the risk of edema. Now, this drug was literally approved just a few weeks ago and will not be available until late 2024 through a restricted program under a REMS called the Trivio REMS. But it's never too early to start learning counseling points to help educate your patients. So here are a few tips to share. The recommended dose of aprocitentan is 12.5 milligrams by mouth once daily. Also, remind the patient that this medication can be taken with or without food. Another important tip to share is to briefly review the symptoms of edema and encourage the patient to report it to their doctor if it occurs. And since this medication has a box warning for embryo-fetal toxicity and is contraindicated in pregnancy, please ensure that you ask if your patient is pregnant or trying to become pregnant. Now, people who can become pregnant must not be pregnant when they start taking aprocitentan. They also cannot become pregnant for 1 month after stopping treatment. So please make sure that individuals that can become pregnant have a negative pregnancy test before starting treatment, during each month of treatment, and 1 month after taking aprocitentan. Now, for patients that can become pregnant, please also advise them to use acceptable contraception prior to treatment initiation, during treatment, and for 1 month after stopping treatment with aprocitentan. Now, with these tips, you'll be sure to have you and your patients ready to optimize their hypertensive regimens. So that's all I have time for today. Please be sure to head to learn.pharmacist.com to earn CE for listening. See you next time.